Hi everybody, welcome to our class for group theory and practice. This is Eliko Ran speaking. I'm going to be the instructor of this class. And let's go through the introduction, what's going to happen in this 9-week class. I hope you are going to follow our required reading, the theory and practice of group psychotherapy by Dr. Irvin Yalom, and that you are going to also read many of the optional reading materials, and that you are going to participate actively in the discussions and in the forum. So welcome. The first slide of this class today is about the goals of this course. And so the main goal of this class is to get familiar with the different types of groups. I'm going to talk more about that. It is about the different types of psychoeducational groups, support groups, process group, therapy groups, those kind of various types and subtypes of groups. I hope that this will be a place for you to explore the types of groups that you want to lead, that you are going to find your passion and your calling, and what types of groups you are ready or are passionate about leading, and that you will also find some types of groups that you might actually not want to lead, so you would know which types of groups you want to steer away from. We are going to learn in depth about group theory of some orientations. It's mostly psychodynamic group therapy that we are going to cover, and you are also going to have the option of learning about Gestalt group therapy and various other types with CBT and DBT. Those are the types of orientations that nowadays many programs facilitate groups in. And I really would like to emphasize that you can ask me anytime any kind of questions that might come up around groups during the course of these few months that we are going to spend together. I am here to help you with your existing groups, or if you have questions about what types of groups you might want to look into, what types of groups you might recommend at your practicum size that they would start so you could lead them, or if any sort of other question comes up, I hope you are going to ask me. The expectations of your practicum sites, I think that is a big question, because we are all going into various practicum sites, and all these different sites, they have groups, different groups by population. So there are some of you who are working or going to work with kids, with adolescents, and in general with various youth groups. And you will see that you can use different modalities, different types of approaches with kids and adolescents. And so you will want to understand what are your options. If it's a play approach, if you are going to practice social skills with different kinds of kids, or if it's anything specific within that population. So you will need different approaches for that. Some of you might work with chemical dependency, people in recovery, either in AA type of groups or in harm reduction. It can be either at an agency, or the next point is hospital groups, which some of them have specific programs for chemical dependency. Usually in hospitals, if you find a hospital site for your internship as a practicum site, you will either be placed in an inpatient unit where you would be leading some groups, and you will do case management also for individual patients. And that is very different to lead groups for the inpatient population as opposed to leading groups for the partial hospitalization or the intensive outpatient program patients. Usually hospitals have the inpatient units, and then they have the partial hospitalization program, which is called PHP, and then the IOP, which is the intensive outpatient program. And usually, or some of the hospitals also have dual programs, which means that the chemical dependency and at the same time, patients who have both chemical dependency or substance issues and chronic mental illness. So you might lead groups for those people, and in the partial hospitalization, patients go home for the night as opposed to the inpatient unit where they stay 24/7 on the unit. And at partial hospitalization, they will be there for several groups a day. And then when they step down to an IOP, which is less hours, usually it's only 4 days a week as opposed to 5 days a week, partial hospitalization programs. So as they are stepping down, and they require less groups per day, also less individual case management, but you will see that the types of groups are changing as you are changing the level of care. So whereas in a partial hospitalization program, you would have various groups each day for helping people navigate their medications, for example, that the psychiatrists will prescribe, but sometimes they have groups where you, the therapist, help the whole group to manage their medications and their symptom management, so they are going to discuss that. So that's more like a psychoeducational group where you are helping them with information. You might lead some skills groups at these facilities and these hospitals, which will include some CBT or DBT skills. Again, that will be more like a teaching model, but usually once you start teaching those CBT or DBT skills, there will be also some more discussion and feedback and interpersonal relationships among the group members. So you will need to add that knowledge, your knowledge of the interpersonal relationships in those groups. And then also hospitals do run some process groups where there are no prompts and you are helping them process their experience. So that will be already closer to the more the clearly identified as a process group in usually that's run in private practice setting. Another type of group that you might run at your practicum site is parenting groups. Usually, again, these are psychoeducational groups. These might be parents of children that belong to a certain subgroup, for example, kids with ADHD, or families where CPS was involved and they now mandated the parents to participate in parenting classes. So these will be more psychoeducational classes. In some agencies, some instances, you might lead also a support group for parents. In some cases, for example, if parents of children with some serious medical issues, so it will be less of a psychoeducational but more a supportive environment that you will have these parents in a group. There are some agencies that specifically work with grieving, with death and dying, or there are some hospice programs that employ interns. So that is, again, a very specific type of group. Either sometimes you might work with the people who are dying, and sometimes you might be working with the family members of the people who are dying or grieving. It's a special skill set to work with that population. And yet another type of population that you might work with is more and more we see groups for LGBT people, either at agencies where you might work with youth, and that's luckily we have this trend that we have more and more services for LGBT youth. It can be a coming out groups, or it can be other ways of supportive groups to addressing the different needs of the LGBT population. So once you identify the kind of population that you're working with in the group, There are also these different types of group that I've already mentioned a few times. So there are psychoeducational groups where really what your task is to convey the information. So it's a very content-based group. Support groups are groups for people who share some kind of common issue. It can be either um, it can be either um, um, I put the medical. I just saw that I put the support in medical settings for with people who share a common medical illness. Like for example, cancer support group. So all the people that you will have in that group, the common element is that they have a certain type of cancer, and some groups will be even specific to the type of cancer the patients have, or the stage of the cancer. And another example is diabetes, or other types of medical illness where you are focusing on the supporting element of the group work. And it's not so much about figuring out how to handle conflict or those situations that would come up more in a process group. But in this case, you are focusing on the supportive aspects of the group work. And so going back to the regular support groups, again, so it can be a broad variety of various issues that somehow there is a common element among the people who are coming here to get support. For example, that would be like a divorce support group. So you will have all the people who are in your group, they're going through divorce, and they want that specific kind of support and from this group. I put CBT, DBT as one of the points because there are various agencies and practicum sites today that really want you to lead a CBT or DBT focused group, and usually they have the training in that specific skill set. Yet you are required to lead a group, so it adds an interesting element to that. It's not only a one-on-one therapy. When, let's say, for the CBT group, you are going to hand out some sheets to the patients that they might work on during the group, and then you discuss it. So when it comes to the discussion part, then you will start seeing those elements that only come up in group, how people feel connected to the other members, how they are listening to other members, how they receive and give feedback when they are hearing the other people, the other group members talking about their work, which you would not have in an individual session where you just help this person identify those thoughts and feelings based on which then they will have a better understanding of their own internal workings, which would lead to those treatment goals that a CBT therapist would have. But in the group, again, you would have that added element of the group, other group members being there. There are specific groups for anger management. There are many agencies that run anger management. Usually they will provide you with a curriculum or specific exercises or that you would work through with the clientele in an anger management group. And then there are agencies that we see more and more where people are working in groups on self-growth. Often these centers would focus on mindfulness. This is what we mostly see in the various therapy settings. It can be also meditation or yoga centers, or the work that would focus on, again, this would be this transpersonal aspects of therapy that you might hope that you would get some of those internship sites, and then we can talk more about that if you find yourself working in that environment, how to incorporate spirituality into that practice while also paying attention to group dynamics. Our next slide is about the underlying process in all the groups. And what I want to emphasize here is that each group has a task, and each group has an underlying process going on in the room. Whenever we are in any kind of group situation, group dynamics is happening. The question if we pay attention to it or not, or how much attention we pay to it. But many of these groups that I just mentioned, they have a certain task, especially those content-based psychoeducational groups. This is a good example of how you have a curriculum, you have a certain amount of time, it is time limited, you have either 8 weeks or so to convey all the material, and maybe in some instances you also want to test if your group members understand or are able to utilize those skills that they have been learning in your group. So that would be the task of the group. But what's happening is when you are in a process group and you are working with those interpersonal underlying processes in the room, you also have that, even if you don't pay attention to it. So what are the benefits of you understanding the process, even if you do not use it explicitly? So even if you are not running a group where you would mention or draw people's attention to it, you will be able to help the group avoid monopolizing. Very often we have group members who take up more airtime or more attention in the group room than other people. So for example, if you have a kids group and if you are playing games with them, you will be able to notice how certain kids might be monopolizing or demanding more attention than others. And not only you will be able to avoid unpleasant situations in the group, but for example, you might be able to help the person who is diagnosing these children. You could give your feedback, what you have seen in the group room, and sometimes that's very helpful feedback, and it helps very much the diagnosis. Preventing scapegoating, that's another important aspect of understanding the underlying group process. As you know, there are many situations when a scapegoating process kicks in, and we are going to talk about that more specifically at the scapegoating stage when we talk about the stages of group development. But I want to mention it here that that it might happen in various other groups when you don't have the luxury of paying attention to that process, but people can get really hurt in the scapegoating process. You might lose group members, which you really are trying to avoid or prevent that from happening. So if you understand what's happening in the process, you might be able to intervene even if you don't name that process. And both of those, avoiding monopolizing and preventing scapegoating, that will both help you to create safety for all the members. We work much better when we feel safe. In fact, if we don't feel safe, usually we are not able to deliver the task. We are not able to perform the task. We are not able to learn those skills that we need to learn if we don't feel safe, and we don't feel safe asking questions. If we don't feel safe sharing in the group, then it will be much more difficult to actually perform what we need to perform, even if it's a task-oriented group. And again, if you understand the underlying processes, you will enhance the effectiveness of the group, and it will be easier and more enjoyable to lead the group. On our next slide, I mentioned a few aspects of what's happening in the room. And these are noticing the resistance, both in individuals and a group level resistance, which we'll talk more about later, handling members' boredom or lack of participation or lack of interest, and understanding and working with your own reactions, their countertransference and biases. The first two here is mostly your understanding of the here and now aspects of group therapy. And that's definitely something that we'll talk a lot more about, the here and now, because that is what gives the zest of our work in group therapy, paying attention to what's happening in the here and now. Again, I think that also is something that relates very well to more spiritual aspects of our work and our life when we pay more attention of what's happening in the here and now. But that aspect of paying attention to what's happening in the room, you will be able to notice the resistance. And what are those things that really people do habitually to stop their own growth or stop their own learning in a way? And very often people will not, well, one obvious example would be is people checking their phones, which we usually tell them that they're not supposed to do. But not only such explicit examples come to mind when we talk about resistance, but people get bored or get sleepy during a group. And even if you are working on a curriculum, or if they have to fill out sheets, um, or if they're listening to each other's stories, you will start noticing that some people get bored, or they some of them will start going to the bathroom. And while that's all part of normal human life to go to the bathroom, but when you start seeing patterns, how people stop participating in the group, in the work of the group, then you can really name it. And I think that usually helps people to come back to participate in the here and now, because that's really hard to notice it and name it in a way that would help these people to come back and get again interested in the work. I think the very important part of this work is to be able to do it in a non-judgmental way. And you will learn if you're leading groups, if you're participating in groups. I think that's a big part of our work, is to figure out how you can do it in a gentle yet effective way. So how you call people's attention to that, hey, what's happening here? You seem to be bored. It won't be a judgment. It won't be, they won't become defensive, so they won't even increase their resistance, but rather they would see your curiosity. So I think it's the curiosity in this case that is the polar opposite of judgment, because when we are curious about what's happening with our clients, with our group members, they feel heard, and they are more likely to engage again in the work that we are doing together. And then the third point is, of course, huge, our understanding ourselves as therapists. When you are leading a group, when you are facilitating, it's very important that you would be as clear as possible about your biases, about your reactions and countertransference. And that's why we have supervisors and consultation and our own therapy. So we bring all these issues that we notice when we are working with a group. And I think that those of you who are leading groups, you know that group work can be very triggering for group facilitators. So you will have a lot of material to bring to your own supervisor or your own therapist, discussing those issues. It's very important for you to notice it in the room, just as you notice what's happening with your group members. But whereas you have a judgment call in a way to bring the client's issues into the room, into the awareness, but you do have a responsibility not to bring in your own issues. So you notice them, hopefully in a non-judgmental way, with as much compassion as you work with your own clients. So you just notice it, you put it to the side, and then you work with it in your own therapy. And the more you work on it, the better group leader you are going to be. Next slide is about the goals of group versus individual therapy. So I have a few slides here about this topic. I thought it's important to think about it together. What are the strengths and weaknesses of these modalities when we are comparing them? So when we are thinking about individual therapy as opposed to group therapy, we can say that in individual work, a very important aspect of that work is that you are building the rapport. You are building a strong individual connection with your client. Usually it feels safe in this dyad in the room. It's only the two of you. You are creating a personal relationship, which is very different from what's happening in the group room. It's different because you have to figure out how to build that safety with a larger number of people. With an individual client, you can choose your own modality that you want to use with this client. Let's say you have a few modalities under your belt and you know in what situations you might use which one, but you have this one specific individual here in the room with you, and you can use whatever you find the most suitable for this client. And you can also set the individual treatment goals, which you also do in groups, but here you can really focus in each session. You can kind of think about that, what are the treatment goals, and when you start seeing that maybe there is a new stage in individual therapy, when maybe you solved some of those original goals, so then you come to this reevaluation phase when you are going to see if maybe new goals need to be set, or you work with the individual on those issues. And it's to a much more specific degree than in group therapy. And then in individual therapy, you can be sensitive to the nuances of the session. You have 50 minutes all for this one client, so you can pay attention to many little details, and you can name them if you choose to. In group, you notice so much more than what you have time to actually verbalize. You, as the leader, you have to very often pick and decide. Very often the facilitator would have this dilemma, which way to go. And as a process comment, it's good to name that you have a dilemma, but also content-wise, you do have to choose what you are going to go with. So the sort of drawbacks of individual therapy as opposed to group therapy: in the individual therapy, the client has only you to work with. If you work with the transference, for example, it becomes very interesting to compare the transference, how it works in individual and group therapy. So with the compared to group therapy, it's relatively limited. What is the transference that the client is going to feel or develop towards you, the therapist? It still can shift. It still can change. You can have various different transferences at different times to the same person, but it's much more limited than in a group setting. And then another thing is that, yes, you have various tools that you tailor to the client, but then there is no broader perspective. So you can work in a focused manner, but in a group setting, it would be you would, at the same time, while you can focus on one aspect or one tool with one client, you would have all these other people who will give their input. Or well, there's the potential that they will do that. So it's individual treatment is very focused, but sometimes it loses that broader perspective that it could have if there were more people in the room. So the limitations of group therapy, in really broad brushstrokes. One of the things is that group therapy sessions cannot be rescheduled. It has a very fixed frame because you have to have it the same time every week if it's a weekly therapy group. Um, if you have an individual client, let's say, who has an emergency or gets sick, so you can reschedule. There is some flexibility with that, but with group, you cannot do that. And really, when one person is not there, it affects the whole group. It's not only in individual therapy, when a client doesn't show up, well, then you have a free hour. But when you reschedule, so that client can make up for that time, they will come a different time. But when they miss a session, they missed. That was a missed opportunity for them to share and for them to hear the other people, and the lack or that lack of that person in that group is really felt very strongly, and it changes the dynamics in the room. Another limitation, obviously, of group therapy is that clients need to share the airtime, so you have less time for yourself, and it is going to be the client's task to figure out when they share and when they listen. But it is definitely a limitation in a way of group therapy, that sometimes clients want to say something, they have something important to say, and then there is no time. Of course, we work around that and we work with that, but it's definitely a limitation compared to individual therapy. And yeah, so there is no time to explore everybody's needs. And also, another important element in group therapy, the limitations, is that there is less acute attention to crises, to urgent needs. So that's why it's very important that when you assess for a group therapy, when you assess a client for group therapy, that you would really find out how likely that this person would be in a crisis situation, and if they need individual therapy or a psychiatrist, so they would have those services lined up, that you would not be the only therapist who is responsible for this person's treatment. So that is very important aspect, and it also it has some consequences in terms of working together with your group clients, individual clinicians, individual therapists, or if they are seeing other service providers. That's an important aspect of group therapy, how you manage that, the communication with those other clinicians. So continuing on the next slide, the group therapy benefits as opposed to individual treatment. So here you have a room full of responses to the same communication. So if I'm the client and if I share something with you, the therapist, I will have one response, or maybe you, the therapist, will decide that you have various things to share with me in response to my communication. You might pick up on the content of what I said, you might pick up on how I said it, or my body language. There are various things you can, as one-on-one therapy. But when we are in a group situation, then when I share something, I don't know who is going to respond to that, and how many different responses I will get. And that can become a very rich experience when we get that many faceted response system, in a way, to one communication. In a group environment, the group gives a broader perspective and allows for clients to see and appreciate various parts of themselves simultaneously. And with this, what I meant to say is that we have various parts that sometimes we pay more attention to, and sometimes they fade in the background. For example, in a depressed person, the hopeless, the depressed parts would come to the forefront, and depressed clients don't are not able to see the more hopeful, or the more promising sides of themselves. And in a group situation, those group members that are reflecting back to the person who is sharing, they might actually help in a very compelling way to have this person see those parts that they cannot see currently in themselves. The group situation brings up a sense of self in community settings from the get-go. I think it's self-explanatory. This means that we live when we are in social situations in our life. When you are in a group therapy setting, you feel right away in a similar kind of self state as you feel in those social situations. And we'll talk more about this, how a group therapy situation is a microcosm of real life situations. So those issues that come up in a client in real life situations, they will definitely come up repeatedly in a group setting. And in the group setting, the goal is to work on those, if we are talking about a process group. So here I shifted a little bit into talking about the process aspects of all these therapy groups. There's an opportunity to repair old wounds and relating styles coming from family of origin. Again, this is something that's more discussed in the second chapter of the Yalom book, so we will read more about that in our next module. But it's definitely, group therapy is definitely an opportunity to look at those relating styles that were established in our early life and in our family of origin, or various other social settings that had a big imprint on our thinking about ourselves. And it's different from individual therapy, because in individual therapy, while you can think about those things, or you can work through specific aspect of yourself with your individual therapist, but in a group therapy situation, you will feel it in the room. You don't have to explain it, don't have to talk about it, but you will actually feel it right there in the room, just because of the sheer existence of those other group members in the room. This time, clients can talk, discuss, and have more agency than in the original powerless situation. So that this sentence explains more how it is a reparative function of group therapy, how you can relate to those people who are sitting here in the room, and through your transference, you would transferences and projections, you would see these people as those or people of that original situation that you got wounded in. But here in this situation, those are other members of the group that you can actually have a conversation with. Like, now you are an adult, you are in a powerful position, you can think, you can talk, you will be listened to, and that is true about all the different members in the group. And so there can be a conversation here, and by itself that will be carrying the therapeutic element of this group therapy environment. So it is a chance to repair, to be heard, and to be seen. I put here in a couple of um, slides about referencing the textbook, and we went through the therapeutic factors in the first chapter of the book. I will just read them off. The installation of hope, universality, imparting information, altruism, the corrective recapitulation of primary family group that we just talked about right now, development of socializing techniques, imitative behavior, and then two big ones, the interpersonal learning and the group cohesiveness that will be talked, Yalom is going to talk about more specifically in the following chapters in the book. Catharsis and existential factors, those are all the identified major therapeutic factors that work in group settings. And since you read the chapter, I'm not going to talk more about these. But also Yalom emphasizes the in-session change. And I think that is an important aspect of group therapy. Again, now we are talking about therapy group and process groups, not the psychoeducational groups. If that this kind of this kind of therapy is an in-session change model, which means that what's going to help you to make changes and shifts towards a healthier, more meaningful life is what you are learning in the here and now in the session with these other people in the group. And it's not something that now you learned a skill and you go out and you practice it and then you come back and you report back next week, which of course is part of the deal, because any kind of therapy in or out of session change models, we always want that people would be able to function better in their life. But these group therapies, the process group and therapy groups, they focus on understanding and experiencing. That's why it's also an experiential type of therapy, when you actually experience that shift in the here and now in the group room. And it's part of this model that you are learning, you are feeling the experience of transcending ourselves and seeing how it affects our work, how our work affects other people, and how other people affect us in a group situation. I want to mention a little bit how to get referrals for a group. I think that's one question that comes up relatively often. What would be the basis for getting referrals for a group that you are running? Again, it's very different at agencies and in private practice groups. If we are talking about, well, in both of them, but especially if we are talking about private practice groups, it is very important that you would become familiar with your community, with other therapists or with other clinicians and providers that your clients might be seeing. And you actually have to educate individual therapists about group work, because there are many individual therapists who don't understand the value of group work. So big part of your life will be, if you are going to lead some groups in your private practices, that you will want to convey the information that you're actually learning now in this course to other individual therapists. Because if you like working with groups, you will have that understanding why it's so beneficial and why it's valuable. And that will help you to convey that information to these other therapists. Conjoint therapy, which means that individual and group therapy at the same time, so parallel, while they continue seeing their individual therapist, that they would start your group. It can be very beneficial. And I'm sure we are going to talk more about that later. But there is a lot of work that can be done when something gets stuck in individual therapy, and both the client and the therapist, they want to continue the therapy, but something is just not going right. So if that client joins a group, there will be lots of things that will be coming up in that group treatment, in the group environment, and then they can bring that back to their individual therapy. Again, partly because, as I said earlier, there is just not enough time in the group environment to address all those issues. But they bring up those in the client, and then the client can go back to their individual therapist to talk about those issues. And that's where the in-depth work will happen in the individual therapy. You can emphasize that when you are talking to these individual therapists who will then refer their clients to you. I like this metaphor, thinking about, somewhat psychoanalytically speaking, comparing the therapist to the dyadic work to the mother-infant dyad. And then if you think about group therapy, it's like letting that child go to play on the playground, but it doesn't mean that the child will stop relating to the mother. So I think you can use that metaphor with the individual therapist, ensuring them that their clients will still need them. The clients will want to go back to get that dyadic work, while they will be also enjoying and learning a lot to by playing on the playground with us in group therapy. And again, when there are blind spots to progress in individual therapy, that's a good time when group work can help, and vice versa. And groups in private practice are very different from agencies and hospitals and residential treatment centers. Right now, while I do talk about private practice groups because that's where the kind of process groups and therapy groups can be run, that I think I want to convey the value of that work to you. But practically speaking, right now, when you are at your practicum sites, you are going to lead those other kinds of groups, the hospital setting groups, the agency settings, the residential groups. In hospitals, what's very specific to the hospital environment is that there are different levels of care, meaning the inpatient, the partial hospitalization, the intensive outpatient program. And so people are going to move quite quickly between those settings. And so on the inpatient unit, you will have a person for a few days or maybe a few weeks. In both partial and intensive outpatient programs, you will have them only for a few weeks, and the work will be very focused. But you want to understand the specific goals of group work in those settings. At an agency, what I think is important to think about is that actually usually there is no assessment opportunity. Whereas patients who come to the hospital, they get thoroughly assessed by an intake clinician, either if it's a nurse, it's a psychiatrist, or the therapist, case managers. People will thoroughly be assessed and diagnosed. At agencies, very often people come and they just announce a new group starting, and you have no idea who are the people who are going to show up in your group. So there are certain aspects of that you want to think about, because you might have people with very different levels of mental health. And it's important to understand the ramifications of that, which we can talk about that later again. In residential treatment, clients processing the setting itself, the milieu, and they live there very often for several months or even like a year or longer. And in the process groups that you are leading there, they are going to share that experience that they are actually in this facility, that they live there. And so that's going to be the focus of much of the process that's happening, not their outside life. And that brings us to the end of this module, of this presentation. So in summary, I'd like to say that I'd like to encourage you to check the other modules of this course, see what is in store for us here. we are going to go through, you have the syllabus, so you know that we are going to read the Yalom book. Read it carefully. It's full of little gems and stories. It's actually an interesting read. I am going to put a lot of other optional readings in the other modules. So based on your specific personal interest, do check them out, see what is there. But it's good to follow the main text so that you would get the backbone of this course. Please post all your questions and comments. I'm very happy to answer. I'm very happy to see questions and comments. I would like to encourage you also to answer each other's questions, because you have very different types of expertise, different settings where you work or life experiences. And we all know about groups, even those of us who haven't led groups before. We definitely all have experiences in groups. And if you think about the questions and these themes that are coming up here for group therapy, we can always ponder about those group theory questions about in those other social situations that we have lived before or that we are currently living in. And that is the end of this presentation. I hope you enjoyed it, and I'm looking forward to discussing it with you in the various discussion forums. Bye for now.